Okay, so here we're starting George's Cafe. I'm just going to walk out, and here we have Tang on the 360 camera, but still. Okay, just walking around the facility. So to introduce you to the facility and the way the place is structured, and this is, I want you to think about the culture of the program and culture of a therapeutic environment. So we've started off with the 12 steps here. We actually built 12 steps here, and the idea is people walk down the path here and their life is kind of heading for a brick wall, and if they want to stop using and stop the addictive behavior, a great place to start is with the 12 steps. And the 12 steps are structured where each 12 steps, 1, 2, 3, 4, up to 12, each step represents a spiritual principle. So honesty, open-mindedness, willingness, faith, trust, acceptance, humility, anonymity, courage, forgiveness, prayer and meditation, generosity, gratitude, a whole lot of principles, and there we have the 12 steps. And this place was really started with myself, and being in recovery myself, having had a spiritual awakening as a result of these steps. We try to carry the message to the addict who still suffers, and to practice these principles in all our affairs. And this is how we started the rehab, and this is where the kind of the 12 steps have influenced what we've created here. But we've gone a lot further than that, and we move now into the facility. This is the reception area. There's Stella. Wave, Stella, say hello. And then we have Fatima in the office there on her phone, who's meant to be working, but she never does. But really this is where we screen people, where they come in and get assessed to see if they're suitable for treatment. Addiction is a medical issue, so we'll check with medical aids, we'll check for resources, we'll check for suitability. Not everyone is suitable for this facility. You have to be sick to enter into our environment, and this is really our therapeutic environment. There's Leanne, getting all self-conscious. And then we move into this area, which is really the house, and this is the container that we talk about, and it's about the therapeutic team managing the culture of this environment. And the way the facility is structured is we have the 12 steps to kind of assist our clients for when they leave treatment, and inside the facility we use the warrior archetypes, king, warrior, magician, lover, and this area here is the area of the warrior. There's nursing there, and there's detox, and so you'll come in, you'll be assessed by the nurse and seen by the doctor, and everything's very clinical, it's very structured, it's very boundarized, there's lots of rules, processes to follow, procedures, detox protocol, medical conditions, and at this area here we've got this tree here, which is really the heart of Sharp on my left hand side, and on my right hand side we've got the 3 rooms here, the 3 detox rooms, and this is really about step 1, 2 and 3. Step 1, 2 and 3 is about honesty, open-mindedness and willingness. And do you honestly admit that there's a problem? Are you open-minded to the solution, and are you willing to do it? And people can expect to be in detox for a week. It's a very contained environment. There's no visitors from family. This is to get the patient settled into the environment. This is to protect the family from the patient, and it's also to protect the patient from the family, to give them a chance to kind of come down and decide whether they want to carry on their journey. If they do want to carry on the journey, they'll move up into this area of the house, and this is really step 4, 5 and 6. This is the quadrant of the lover, and 4, 5 and 6 is about going back into the past and looking at what's caused the problems, and which is basically your addiction and how you're going to work on your recovery. And this is often kind of a painful process. Our clients have to take a look at the consequences of their behavior and what they're going to do going forward. And we have these 5 steps here. There's 1, 2, 3, 4, 5, and they represent the 5 principles of recovery: self, service, society, and God. And if you work with all those together, you'll get an understanding of what a higher power is. And if you hand your life over and become entirely ready, stuff happens and grows. So we're moving from that environment which is very masculine, which is very hard, to more this environment which is much more kind of feminine, Mother Earth, Mother Nature. Oh, look at those wonderful birds there. And then we move over to this quadrant, and this quadrant here is the area of the magician. This is steps 7, 8, and 9, and basically you kind of decide, well, this is the emotion of fear, and how you can embrace that fear and like kind of plan for your life going forward and looking forward down into the future. So step 7 is about, being aware of our shortcomings and how they've kind of impacted our relationships with ourselves and with others, which is really what step 8 is about, becoming willing to change all that stuff. And then if you move over to here, we have step 9, and this table kind of symbolizes making amends and rebuilding those relationships. And that tree there was donated to us by Johan Deploy, who's one of our students in Cape Town. And as we kind of rebuild all our relationships and everything, we move into step 10, 11, and 12, which is the realm of the king or sovereign. It's about, now that you're free from the prison of addiction, what kind of world are you going to create for yourself? So this is about continuing to take personal inventory. When you're wrong, promptly admitting it, trying to work out what your life's purpose is, and going off and doing good in the world. And so we have a wonderful garden here. This used to be a tennis court. We lifted up the tennis court and we turned that clay into soil. And addiction is a very hard world, and recovery is kind of a very abundant world. One promise, many gifts, as they say in the NA fellowship. And really what we've done here is we've created a bioenergetical garden. Everything's organic here, and it's self-sustaining. We have a lot of fun here. And so we'll just keep moving on here. And this is really the environment that we have. So that's what the structure is. If we go around, again, hello Ati up there. If we go around up to that house there, that's where admissions happen, and we screen people that are suitable for the environment. They'll come into the archetype of the warrior, which is step 1, 2, and 3. They'll move over to the lover, which is the house, which is 4, 5, and 6. Is going to look at what caused the problem. 7, 8, and 9 is about facing up to the problem, and 10, 11, and 12, which is here, is about growing up. And this is how the facility's been designed, and this is how it's working. So I hope you've enjoyed the tour of the facility. For the students that are watching this is all part of the therapeutic structure and culture of the environment that your clients are coming into. So whatever your facility is, you need to kind of consider what the physical environment is and the type of culture of recovery that you want to create there. If your clients are in a punitive environment that is kind of depressing, or like a crack house or something, you're going to have to ask yourself, what's that about? How is that conducive to recovery? Does it help? Does it assist the client, or does the client persist with that behavior? A lot of families that come here with their loved ones, they often get very angry and jealous, and think, because they're so angry, they think that the clients must be punished. So if the environment's good, they get upset. They can kind of get angry. And then what you would do with that is you'd bring that into the family session and talk about, just kind of explain it to the family what we're trying to achieve there. And other people kind of have ideas that rehabs, you're going to get tied down. And is that a scarf you just made in arts and crafts? Cool. Scarf, did I say? Mask. Very nice. Explain it to us. What's the keyhole there for?
I don't know, I just put it there to scare people.
Okay, very, very nice. What did you learn in arts and crafts today? Or what did the clients learn?
I don't know.
Well, what were they talking about? What was the theme?
Just make something.
Just make some the masks we wear. Yeah? Cool. Alright, well, Luke has just joined the clients in the arts and crafts. On a Wednesday, they have an arts and crafts group where, as part of the therapeutic environment, people talk to each other. Anyway, take a look, have a look around, decide what you like, comment, and let's see if this all works. Okay, thanks, bye.